Okay, it's Dr. Janowski. We're going to talk about and demonstrate the silhouette lift. Fantastic thread lift, non-surgical facelift. Today we're just going to do the lower face. So we're going to just help Laurel get a little tighter around the jawline. Now she doesn't have a lot going on, but we're just going to make it a little bit tighter. So people who have jowling or loose skin here, everybody hates that. They all go, what can you do for this? Well, we can do something without surgery if it's mild. And just reposition the tissue just a little bit with a thread that pulls on the skin from underneath. You don't feel it, you don't see it, and eventually it goes away. It lasts about 18 months. So we're going to use one single silhouette thread on each side. We're going to place it from the entry point here in the corner. There's an exit point here, an exit point here. So what I'm doing now is I'm just going to mark the areas that we're going to use as our entry point and our exit point. They're different length and different size threads, and they all have little cones that run through them, and that's what holds onto the skin. So that's the marking. Okay, the second part is just to numb the areas with a little local anesthetic in those 3 points on each side. So I'm going to use a little buzzer so that it doesn't hurt, and a little tiny bit of local. So you'll feel a buzz. Here we go. And then a little pinch. 1, 2, 3. And that's it, and we'll do the same thing on the other. So now what we're going to do is create a single entry point with a needle in the numb area right in the corner of the jaw. So just a little needle, a little pinch. Probably won't feel it because it's already numb. Okay, now that we've made that tiny little entry point, we're just going to use our silhouette thread. You can see the cones, they're very tiny, and that's what's going to do the gripping and the pulling. And we're just going to pass this needle from the entry point to exit point. And there's not a lot of sensation just under the skin, so most patients don't really feel much, if anything. And then we just push it through our exit point. Patient doesn't feel anything. And now we're going to thread this product through. Good, so that's 1/2 done. How did that go, Laurel?
That was easy.
Easy? Didn't
Easy.
feel a thing?
Didn't feel a thing.
Okay. Now, we'll do the other half. Up in this direction, same way. Re-enter, the same entry point. Go a little bit below the skin and just pass it gently underneath. Like that. And then again, we're just going to find the tip at the numb area and push it through. Okay? And then we're going to pass the thread through. And again, the patient may feel some clicking noises. And that's in. So that thread is in. So now what we do is we simply tighten. This is the important part where we get that skin to tighten up by draping it over the cones. And I'm going to do a little bit of pulling. Here we go. A little pull here. Just massaging the area. And then the same thing on this side. Massaging the area. Okay. And the last step is simply to cut the thread end. It will snap back underneath the skin. The patient won't see it or feel it. And that is it. That's all there is to it. Okay, so we just finished the procedure for the jawline lift. It took maybe 7 minutes, 8 minutes to do. It's very fast and easy, and there's really not much to see in terms of recovery. There's a tiny little poke mark there where we went in. These little areas where we put the anesthetic will be gone in about an hour, and really you can pretty much go back to what you're doing. We tell people after this procedure, don't do anything that causes stress or strain on the threads, like excessive smiling, chewing on hard foods, and moderate your exercise for the first week. But how was that experience? Was that uncomfortable?
It was not uncomfortable. It was easy. You could feel a little of the pulling. You could kind of hear it more than you can feel it. So, but it was not
you
there.
hear kind of a clicking sound as it goes in. And you can see she's got just a nice straight jawline. You know, Laurel had just a subtle jowling effect, so we tighten that up pretty easily with a single thread. We also, of course, can do the upper or the mid face with a second thread, which most people will do if they want a little bit of lift here. That will help the fold, corner of the mouth, and give you a higher cheek. So it's really super easy to do. A lot easier, of course, than facelifts, which most people don't want or necessarily need. And the thread will last about 18 months and then it will disappear. And it can be repeated as needed. So that's the Silhouette InstaLift.